Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the Centers for Disease Control and Prevention, more than 38 million Americans have diabetes, with more than 90% of those having type 2 diabetes. How do you live with it? How do you manage it? And can you reverse it? Joining us to talk about this is Dr. Gabriela Jordan. She's an endocrinologist with the Scripps Clinic Medical Group in San Diego, California. Doctor, thanks so much for being with us.
Thank you so much for having me.
So what's the difference between type 1 and type 2 diabetes?
So type 1 diabetes is an autoimmune condition, usually diagnosed at a young age, where your body is not able to produce enough insulin on its own. Specifically, the pancreas is not able to produce insulin. Type 2 diabetes is usually diagnosed at a later age and is when your body is still able to produce insulin, but over time your body becomes resistant to insulin. And after years, patients may end up requiring insulin as part of their treatment.
And what's the symptoms of type 2 diabetes?
Type 2 diabetes in its initial stages is without any symptoms, which makes it tricky to diagnose. And that's why it's really important to make sure that you're up to date with your screening, especially if you are at higher risk. And the symptoms when your blood sugars are high over weeks to months can be having to urinate frequently, feeling very, very hungry, and having unexplained weight loss.
Who is most at risk?
So the people at most at risk are people who have a strong family history, so having one or both parents or any family members with a history of diabetes. Also, certain races are at higher risk for type 2 diabetes, having a sedentary lifestyle, being overweight, having high blood pressure, high cholesterol, and being on certain medications and having certain medical conditions can also increase your risk for diabetes.
So talk a little bit more about the genetic component. If somebody in your family, father, mother, has type 2 diabetes, how much more likely are you to have it?
So if one or both of your parents has a history of type 2 diabetes, you are 2 to 4 times more likely than the general population to have type 2 diabetes. Also, a majority of patients who are diagnosed with type 2 diabetes do have somebody in their family with type 2 diabetes.
So talk about the connection between weight and diabetes.
So having increased weight, having a body mass index, also known as BMI, in the overweight or obese range has been shown to significantly increase the risk for developing prediabetes and subsequently type 2 diabetes.
And what about belly fat? Because a lot of women, post-menopause, they end up with belly fat.
So having fat around your abdomen has been shown to increase your risk for developing type 2 diabetes, as well as other other components of the metabolic syndrome, including high cholesterol, high blood pressure, something called fatty liver disease. So that is something that we monitor closely to make sure that we reduce risks of developing those complications over time.
And more teens and young adults are developing type 2 diabetes than in the past. Why is this?
So it's a combination of genetics as well as the environment that we live in. We increasingly live in an environment where we're more sedentary. We spend more time in front of screens, starting at a very young age. We see children on screens, watching TV, spending time on the computer. So they're more sedentary overall. And we also live in an environment where there's an abundance of highly processed, high sugar, high carbohydrate foods that are readily accessible. And the combination of, genetic predisposition or genetic factors and this environment that we live in has significantly contributed to developing prediabetes and overweight and obesity at younger ages.
So can type 2 diabetes be prevented or delayed with some lifestyle changes? Let's say you get out and exercise more, you spend less time in front of the screen, you eat natural foods as opposed to processed foods.
Yes, and it has absolutely been shown to be prevented and delayed with lifestyle changes. There have been studies of thousands of patients that have shown comparing lifestyle interventions, so diet, a healthy diet, as well as regular exercise, usually around 150 minutes at least per week, compared to not implementing those changes, and it has shown to be effective in delaying or even preventing type 2 diabetes.
Can you reverse type 2 diabetes?
Yes, you can with, diet and lifestyle changes, as well as monitoring your blood sugars closely and maintaining what we call good glucose control. It's possible to reduce your overall blood sugars. And while there's no specific cure for diabetes, so we don't have a specific treatment that can absolutely eliminate diabetes, it is possible to reverse it and keep your blood sugars under control with the diet and lifestyle changes.
How do you test for type 2 diabetes?
There are a few different ways to test. They're all blood tests. The most commonly used test is called a hemoglobin A1C, which is a blood test that you can do at any laboratory that measures your average blood sugar over the past 3 months. So it gives a good representation of your average blood sugars. Another blood test is a fasting morning blood sugar. So you don't eat overnight and you do a blood test in the morning. And the third type of test is called a glucose tolerance test, where your doctor will prescribe a sugary drink, a glucose drink, that you'll drink and then have your blood sugars checked an hour and 2 hours afterwards to see how your body responds to taking in glucose.
And how do you treat type 2 diabetes?
Thankfully, we have so many options for type 2 diabetes treatment. For some patients, they do require insulin, which is can be through a pen or a needle and syringe. And we also have injectable medications called GLP-1 agonists. We have one here that's also in a pen. And they're very simple to use, and they're injected in your abdomen, in your upper thigh, or in the back of your arm. And there are also multiple different types of pills that are used for diabetes, type 2 diabetes as well. Some of them are taken with meals, some of them are once or twice a day, but there are a lot of different options between pills and injectable medications that are used to treat patients with type 2 diabetes.
What kind of foods can you eat that will fight type 2 diabetes?
That's a great question. So one of the most studied diets is the Mediterranean diet. And that diet has been shown not only to help with weight loss, but to help improve blood sugar control and even help prevent diabetes with this particular type of diet, which emphasizes plant-based foods, so fruits and vegetables, seeds, legumes, nuts, also lean proteins like chicken and fish, and also some dairy, low-fat yogurt and cheeses, and healthy oils like olive oil, and really trying to avoid highly processed foods and high sugary foods.
There's lots of innovative technology out there that actually helps you track your blood sugar levels in real time. Can you explain that a little bit?
Yes, so we have something called a continuous glucose monitor, or CGM, which is a device that is very small. Some of them are coin size, that you stick on your arm or on your abdomen, that can stay there for anywhere from 10 to 14 days and provide continuous glucose measurements that either go to a small device or that sync with your smartphone. And this is a great option for patients so that they don't have to do a finger prick every time they want to get a blood sugar measurement. So it's a really great tool that we have for patients with diabetes.
Any final thoughts, doctor?
Yes. So as you mentioned, type 2 diabetes is an extremely common condition, both in the United States and worldwide, and people are being diagnosed at younger and younger ages. So it's very important to make sure you meet with your primary care doctor annually, discuss any concerns about type 2 diabetes, if you have any risk factors, and also if you have type 2 diabetes, knowing that it can be reversed with excellent diet and lifestyle changes.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you so much for having me.
If you want more information on how to manage type 2 diabetes, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.